Diabetes doesn't have a lot of symptoms at the beginning. When the sugars are very high, then you will get symptoms, but that's usually a later diagnosis. So common symptoms with diabetes when the sugars are really high is weight loss, is thirst, is passing your urine much more frequently and going to the washroom more often, and then fatigue is one of the big symptoms. And so those are the main symptoms if the sugars are very high. But if your diabetes is very mild, you might not have any of these symptoms. Some patients do feel fatigue very early on, but none of the other ones. They might not lose weight, they might not have any other issues. So one of the things about diabetes, because it's so important to diagnose it early, because you can do much more when you find the disease earlier than later, is actually to be aware of your family history. And if you have a history of diabetes in the family, it is very important to let your physicians know, and then to go for your checkups and have them checked every 1 to 3 years, depending on your age. You should have a glucose level checked. Or if you had a history of gestational diabetes, then you know later in life you might get diabetes, so you should have your glucose level checked. It's a lab test and it can be picked up before you even get symptoms.